As Steward Health Care's financial struggles worsen, Governor Maura Heeley is sending a clear message. Get out of our state. The for-profit network is buried in debt and is behind on key payments. And Heeley says that Steward hasn't been forthcoming with key financial documents that they're legally required to share with the state. That's left state leaders increasingly unsure about the future of Massachusetts health care as the impacts of Steward's crisis ripples out to other hospitals across the state. Joining me to discuss are Greg Wilmot, President and CEO of the East Boston Neighborhood Health Center, Tim Quigley, the Senior Vice President of Special Projects for South Shore Health, and Alan Sager, Director of the Health Reform Program at Boston University. Thank you so much for being with us.
Thank you.
Thanks for having us.
Well, I mean, Greg, we talked a little bit about this off camera in terms of the ripple effect for patients. I wonder if you can speak a little bit to that.
Wonderful. Thank you, Crystal.
Yeah.
It's really important to understand that the Massachusetts health system is a fragile ecosystem. So any significant impact to access is going to have a downstream impact on other hospitals, other access points in our system. And I think that's the major concern right now is what is the downstream effect that we're going to experience in communities of color, in communities across the state, particularly around emergency room access, primary care access, specialty care access, and inpatient beds.
Do you anticipate if Steward does start closing down their facilities, you all will have to sort of pick up that patient load?
Absolutely. Just on kind of recent data, some of the Boston area Steward hospitals, in terms of emergency department visits, are probably about 45,000 emergency department visits. Where are those going to go? They're likely going to go to other area hospitals and to organizations like mine. The East Boston Neighborhood Health Center operates the only satellite emergency department facility in the state, and we will certainly see some increased volume in our ED.
Yeah. Alan, I recently watched the Boston City Council meeting on this topic, and you made a really interesting comment. You said that state officials, they are clear about what they will not do rather than what they will do. I wonder if you could explain a little bit about that.
Well, that's right. State government has said no money for Steward, for example. The real challenge is, can state government quickly pick up the tools it needs to stabilize every needed hospital, especially the Steward ones? Because too long in the past, for too long, state government has lurched from one crisis to another. And we need knowledge, we need legal power, and we need money in state government. Knowledge of which hospitals are needed where, the legal power to petition a judge to put a hospital in receivership when it's needed and on the ropes. And third, an emergency hospital stabilization fund financed by tiny assessments on hospitals themselves that will act as an insurance policy.
Tim, I'm curious about what you think the impact on patients will be.
I agree completely with what Greg had said before. I think 70% of our patients that are in hospitals today comes from the emergency department. So I think the ground zero, the biggest challenge really is the ED and that redistribution of volume that Greg talked about. I also think that the primary care issue and specialty issues all play to drive people towards the emergency department, and people arrive sicker and less well prepared with more advanced disease as opposed to going upstream. So I think South Shore, for example, in this region, we've had Quincy Hospital close and Norwood close because of a flood. So those are two Steward hospitals. We also had an unfortunate fire at Signature Brockton, so lost 200 beds in the region and a busy 60,000 visit ED there. So, and then we had Compass Medical Group close very abruptly, which really restricted access to a lot of primary care and specialty pieces. So I couldn't agree with Greg more and Dr. Sager and more in terms of having a rational approach to this. I do think that the state has been working furiously on this, but there's a lot of ground to cover in a short period of time.
I think one of a lot of the critics of this situation has talked about is that this was preventable. So some of this has been seen coming down the pike here. And I know, Dr. Sager, you spoke to this before, that a lot of what we're seeing now with Steward was preventable.
It was preventable. The original sale of the 6 Caritas Christi hospitals to Steward was a mistake. And I don't think then Attorney General Quigley should have approved it. I don't think she had the guarantees that were needed, but the Archdiocese was desperately anxious, for understandable reasons, to get out of owning hospitals. And the then Attorney General allowed the Cerberus and Steward purchase as a way of patching things together. But if you stumble from one crisis to another, you don't really fix the problem. And that's, in a way, that's crazy, because healthcare spending in the country is 5 times defense spending. Massachusetts this year will see our hospitals spend $45 billion alone and $125 billion on healthcare overall. That's $18,000 per citizen. It's enough to do the job.
Yeah, that's absolutely right. You know, I want to pull up a fact or figure here from December 2023. A study from the Journal of the American Medical Association showed that private equity acquisition of hospitals on average are associated with increased hospital-acquired adverse events, despite likely lower risk pool of admitted Medicare beneficiaries, suggesting that poor quality of inpatient care. I'm curious, Greg, when we talk about, this impending closure and what that domino effect we've been talking about, what that looks like, is there a concern that, you're going to hit capacity and not be able to treat patients the way you want to?
It's a great question. It is a fragile system. Mm-hmm. So we know that any change in access is going to have an impact. I think the hope is, with time and intentionality, we can plan for where those impacts will likely be felt and be able to take measures to intervene. That might come in the form of, how do we expand primary care? How do we invest in community health centers? How do we expand capacity at area hospitals? So there are a number of ways for us to get ahead of this kind of impacting patients. But I do think that that's the concern, is if we're not able to really get in front of this early enough, we're going to start to see impacts to patients, and ultimately, particularly for communities like those served by the East Boston Neighborhood Health Center, largely black and brown patients. Mm-hmm. The equity issues that we've been concerned about, that we've been working so hard to close, those will over time be further exacerbated. So I think with a planned approach, we have a great opportunity to course correct.
Yeah. Tim, you mentioned all of the hospitals and healthcare facilities closed in your region. How do you then plan for another potential situation, another hospital system closing down?
So we've worked with the state to have those convening cards. They've acted as a convener to really get people around the table, just like Greg said, with the community health centers and the other providers in the market. And it's a ecosystem. I love the term that he used, because it's not just the hospital side. It's primary care access, there's urgent care pieces, there's specialty care. All those pieces need to be really considered. So I do think you have to look at a more central approach and what's rational, for allocation of resources, and try to figure out what's the right way to allocate resources to get the best possible outcome for patients, with OB programs, pediatric programs, specialty surgical programs. There's just a lot of moving parts. It's a complex system. The ecosystem metaphor is a great one. So I do think you really have to sit with data and plan this out. And I couldn't agree more with Dr. Sager. We're spending as a country the money, but not getting the outcomes that investment would normally return. And I think that there's a major discussion about choice and networks, and how our system has evolved right now is not it's reactive and not rationally planned out. So I do think private equity, your point earlier, is a great one. And, you know, what is the role of private equity and stuff? Return on investment is how that fits with caring for patients and meeting where they're at is a really interesting social conversation and a social justice conversation to have, frankly.
Yeah, and Dr. Sager, I know I want you to give you a second to respond, but like I'm also thoughtful about when we're using these terms from the business world, when talking about people who may have chronic illnesses or people who were set up from the beginning to not walk into their best health and need the healthcare system, you know, in talking about return investments and things like that and having for-profit hospitals, it seems sort of antithetical to the actual practice of medicine and of operating hospitals. So, Dr. Sager, I will ask you, you know, as we look forward to whatever the plan that Steward Health is actually going to tell us about. You know, we know the governor wants them out completely. What do we need to be doing as a state in terms of learning our lesson about what happened here with Steward hospitals?
The state has to stop sleepwalking from one crisis to another. For decades, we've been, some people have seduced state government into thinking that all you need is watchful waiting. But if you're awake for hour after hour, you fall asleep. So state government has to pay attention. It has to recognize that there is no functioning free market in healthcare. So competition and profits are not legitimate. But when you don't have a functioning free market or competent state government, you have anarchy. And that's how we manage to spend so much and have what's been called on our program today, a fragile system. We talk much more than we act, and state government needs to stop ignoring the problem and then just patching together quick solutions that aren't durable, but instead step back and figure out how we take care of 7 million people and recognize this is the easiest problem, not easy, but easier than any of the others, the easiest problem to fix because it's the only one on which we already spend enough money.
Certainly lots to break down here. Greg Wilmot, Tim Quigley, and Alan Sager. Thank you so much for your time. I really appreciate it.
Thank you.
Thank you for having us.
Thank you.